Houston Police Department Missing Persons Division, Officer Hall.
When the initial call comes into the police department, we want a clear and good description of the missing person, a good clothing description.
Okay, what was he last wearing?
Whether their clothing is weather appropriate. We're also wanting to know if they're on any medications, when the last time they took that medication, as well as when they're due for their next medication.
Do you know if they took the medication today?
And as the call's coming in and we're receiving the information that the person has Alzheimer's disease, that this is an endangered missing person, we're starting to assign another officer to do a critical release, possibly even a media release, and getting the information out to other law enforcement agencies, getting information out to hospitals, getting information out to the public to let them know that this person is missing. Many times when we arrive, we're 10 steps closer to locating this person. He was reported wearing white shirt, blue jeans. A lot of times people with Alzheimer's will be talking about things in the past. So if they're talking about going to work and they haven't worked in 10 years, we want to know maybe where they lived during that time, where they used to work during that time. Did they live at this location?
No, we lived in Clear Lake.
So we'll simultaneously start sending officers to those locations. We want to be careful and talk with the caregiver and get as much information from them, but do it in a manner that is going to be comforting to them as well.
Typically, a CIT officer and the mental health professional are going to ask the family members questions to help determine what state of mind the person was in at the time of missing.
How's his sleeping and eating habits?
They can also determine whether that person has ever been seen in the county hospital system and has a diagnosis of dementia, which is a vital component of our Silver Alert system. We have to have a medical diagnosis of a person over 65 with dementia to get the Silver Alert placed on the freeway signs that are on the side of the freeway.
We know that people with Alzheimer's have issues with cognitive mapping, and they would quite possibly get lost in a small room, closet, and not know how to get out. So it's critical that we not only check the bedrooms, the bathrooms, the open areas, but also the closets, the pantries, attics, and the tightest of areas where a person could fit. When the search moves outside the house, we're going to start at one point and work our way around the house, looking through the shrubs, around trees, obstacles. If there's a pool, we want to look in the pool and make sure we can see the bottom of the pool, and then continue from there outward into the neighborhood.
Good morning. We'll pass out flyers to any resource we can use. More eyes out there that we can have, the better.
Civilian search groups are critical in searching for people with Alzheimer's. As we know, law enforcement resources as far as personnel are limited. We called in Tim Miller with EquiSearch. He's providing 40 civilian searchers. He's bringing in 10 ATVs. We can call upon the community to help us. They can pass out flyers.
How you doing? Good. When y'all are driving around there, if you can go ahead and keep your eyes out for them.
Many search organizations have four-wheelers, horseback. Some of them have accessibility to aircraft, and all those resources add to what we already have and can enhance our ability to locate this person safely.
The command center is never set next to the house. For reasons we don't want the media where the family's at. We want a little privacy, a little separation.
74 years old. He is diagnosed with Alzheimer's disease.
When working with volunteers, it's important that the incident commander hold a meeting before any search to let everybody know basically what they're going to be doing and what to be aware of. The officers and the Texas EquiSearch, we need to line up and we'll do a grid search. When we're walking throughout the neighborhood and there's paths and trails possibly, we're paying special attention 10 to 15 feet outside that trail because we know most people with Alzheimer's are located within that distance. When searching a field, you want to keep in mind that there could be depressions in the ground where there could be bodies of water that you can't see from one location. So it is critical to line up all your searchers about an arm or two lengths apart and walk the entire field, and we can mark it off our list as places to search. The use of the ATVs And the bicycles and the mounted patrol are very important because they can cover a large area in a very quick amount of time and get a higher perspective. And so if there's higher bushes, they can look into those bushes and have a better advantage than somebody close to the ground. While we're searching, we also need to watch out and take note of natural barriers, that whether it's a road, a bayou, it could be a bridge. Typically with people with Alzheimer's, they get to a barrier and either they're going to stop at the barrier or they're going to have to choose which way to go.
After the missing person is located, we have a debriefing with the family, answer any questions or try to answer any questions they may have, and also have possible suggestions for them.
Many times, caregivers are basically at a wit's end on what they can do, and they're looking for assistance from somebody. So during that debriefing, we're basically providing them with ideas to better help their loved one.
Does he normally carry cash?
Over the years, this has just evolved into a system that we have created that we can now, what used to take hours takes minutes to do. And we're getting information out, getting resources out, and as well as feet on the ground looking for this person in order to have a safe recovery.
As baby boomers reach retirement age, more and more families will be touched by Alzheimer's disease and related dementia. Police departments, large and small, can expect a substantial increase in related calls. The practices you've learned in this video will help support these individuals and their caregivers with compassion and efficiency, and help lead to successful outcomes for your police department and members of your community.